Welcome, kids. I'm gonna learn you a thing or two about bones, specifically the lower limb bones, or as normal people call them, the leg bones. If you've ever studied bones, or any anatomy for that matter, you know it's really confusing and boring. Because of this, I wanted to make it as fun as possible. But I know my limits, and that's not happening. So buckle up, because this is about to be more boring than your grandma's freaking funeral. At the very top, we got the femur. The femur is the only bone in the upper leg, which is basically from your knee to your hip. It's considered a long bone, and as you might have guessed, it's the longest bone in the body. The one notable gender difference of the femur also has to do with the length. A male will usually have more than 48.45 centimeters, while the female is for the most part less than 38.58 centimeters. And this way, you can tell if the bones in your backyard are a guy's or a girl's. But if there's a femur that is from 38.58 through 48.45 centimeters, then there's no way to determine if that particular femur is male or female. There are three main parts of the femur: the upper body and lower. The upper connects to the pelvis, whereas the lower connects to the kneecap. One big disease that affects the femur is Perthes disease, a rare childhood condition which happens when the blood supply to the pelvis is messed up. And sometimes, the leg needs to be amputated to cure that person of the disease. Next we got the patella, but as everyone knows it as the kneecap. This is a flat bone since, look at it, it's basically a pancake, but like one of those deformed ones your mom makes that's more like a triangle. You get my point. The patella is really important due to the fact that it helps your legs extend better. See, without the patella, your leg would be like a door that hasn't fully closed, just enough out of place to trigger a 14-year-old girl with OCD. I guess our ancestors got kinda annoyed at their complaining. The main gender difference of this bone also has to do with a medical condition. Patellar dislocation is more common in females than males. It happens when the patella falls out of place, thereby dislocating it. Usually when this happens, a doctor or someone has to come in and jam it back into its right position. But sometimes it does it on its own. Call it magic, I guess. One rare, and in my professional opinion, cooler disease is exotosis. This is a nice little disease that happens when an additional frickin' bone grows inside the patella. And this causes chronic pain when the extra bone is formed. In that case, make sure to drink your milk tonight. Moving on, let's talk about the tibia. The tibia is what you know as the shin bone, and is a long bone, second in length only to the femur. People often confuse the tibia and the femur, and when you put a picture of the two next to each other, it's not hard to see why. The tibia is a pretty goddamn strong bone. While walking, it's modeled to taking an axis that measures up to 4.7 body weight. However, as anyone who's played soccer without shin guards probably knows, the tibia is incredibly sensitive, causing terrible pain when hit with enough force. I'm talking true agony here. If you don't believe me, try it for yourself. All you need is a baseball bat and a dream. The shin bone is made up of a diaphysis and two epiphyses, the prior being the shaft or midsection, while the two epiphyses being close to the thigh and foot respectively. Like most bones, the main gender difference here is the size of the thing. Guys have slightly bigger bones, while girls have slightly smaller bones. On the disease side of things, one distinguished example is Blount's disease. It's also called tibia vara. It's a growth disorder found in the tibia. This is when the entire lower leg bends inward, basically turning your legs from the normal exclamation point to parentheses. Take a look for yourself. It doesn't look very nice. Now let's take a look at the tibia's younger and more boring brother, the fibula, or as some people call it, the calf bone. It's on the lateral side of the tibia, and while it's considered to be a long bone, it's the thinnest of the bunch. The fibula is divided into three main parts: the head, the body, and the lateral malleolus. When not having a major function, the bone does provide stability for the ankle, and even has grooves for a few ligaments, giving them leverage, which in turn multiplies their muscle force. When it comes to disease, the fibula has no major ones. The only real clinical problems relate to boring old fractures. Like I said earlier, this bone is kind of like tibia's younger, more boring brother. It doesn't do much and it's just kind of there. Next we have the 7 tarsal bones. Now these aren't equal in importance, but all in all they are pretty significant together. You got talus, calcaneus, navicular, cuboid, and the 3 cuneiforms. The talus is the ankle bone and connects to the tibia and fibula to make the ankle joint. The calcaneus is what makes the heel and can be referred to as the heel bone. The navicular is very small and can be found in most animals. Apparently, it's pretty significant in horses. The cuboid is the most lateral of the tarsals, attaching to only one muscle, the tibialis posterior. The 3 cuneiforms are lined up right above the metatarsal bones. The medial cuneiform is the largest, with the intermediate cuneiform being the smallest. The lateral cuneiform is in between them in size. These tarsal bones are realistically the base of the foot, and they connect the bones from the leg to the metacarpals. Speaking of, let's start with the metatarsal bones. Okay, so these are 5 long bones in the foot. They're basically the ones between the heel and the toes. They're also analogous to the metacarpals of the hand, which means that they're like brothers, but as humans evolved over time, especially when we began to walk upright, the 2 groups of bones changed to the point where they're like cousins now rather than brothers. Another wacky evolutionary fact about metatarsals, in most land mammals, they aren't in the foot. Yeah, it's all a bunch of BS your primate-loving teachers are trying to brainwash you with. In horses, goats, and elephants, the metatarsals are in the lower leg. And your quote-unquote ankle, yeah, that's the knee in those animals. Thanks a lot, walking upright. Back to the topic at hand. Metatarsals, unfortunately, don't have any individual names. I guess the scientists got lazy or something. But never fear, they decided to solve their problems like the geniuses they were, by numbering the bones. Usually this meant with Roman numerals. Wait a minute. Numbering instead of using names. Solving problems in the worst ways possible. Yeah, these scientists are definitely German. Finally, we've reached the end. The phalanges. Now, these are the bones on your fingers and your toes. But we're talking about the lower limb bones here, so forget about the fingers part. You've got 2 phalanges bones in your big toe, and 3 in every toe. Doing the math, this means that there are 14 phalanges on each hand and foot. This ends up becoming a total of 56 phalanges in every human body. Like most other bones we've talked about, they're classified as long bones, which I don't know why, they're tiny, but whatever. The phalanges have 1 central part and 2 extremities. The main use of the phalanges are to A, help carry and grab stuff, and B, shape nails. The main clinical concern with phalanges is arthritis. It's pretty common. You might have heard of it on all those commercials that they have about it. Yeah, it only gets worse with age. Oh, and while there are medications for it, there's no current way to cure the disease. And on that happy note, I'm Lucas, and I will see you next time.